Hey everyone, Victor here, and today we're going to talk about a more serious topic, complications after limb lengthening surgery. They can be grouped into two categories, recoverable or avoidable complications, and understanding the difference can help you realize what's normal or not, giving you peace of mind if by chance you happen to experience them during your lengthening process. Before we dive in, let's clarify the difference between an avoidable and a recoverable complication. So, avoidable complications shouldn't occur if you're in the hands of an experienced surgeon. These are the severe issues that can be prevented with expertise, or at least a majority of the time, minus some rare circumstances. On the other hand, recoverable complications are those that might happen. However, they can be effectively managed and overcome in the hands of an experienced surgeon and you being a compliant patient. Otherwise, they may linger, get worse, and possibly become permanent. All right, so let's talk about the avoidable complications. So these include fat embolism, pulmonary embolism, osteomyelitis, which is a deep bone infection, compartment syndrome, non-union, axial deviation, severe muscle contractures, nerve damage, and finally, premature consolidation. Each of these complications carries significant risks and are preventable. So now what we're gonna do is chart out these bad boys and go through some slides, briefly explaining each one. And instead of saying how likely they are to happen, as they shouldn't, we're gonna rank them in terms of the degree of severity if they're left to linger and they're not tended to fast enough. All right, guys, we're going to talk about the avoidable complications. And first up, we have fat embolism. So this is a very serious yet rare complication if it does happen, but essentially it is fat blockage in your pulmonary circulatory system. So this actually happens in all limb lengthening cases. Heck, it even happens when you break your leg out in the wild from an accident. But essentially, inside of all your long bones, there's this bone marrow, and bone marrow is made up of fat. And if you're getting an internal nail done, the surgeon's going to actually remount the inside of your bone with a reamer. And if they don't vent the bone properly, which is like when they drill little small holes in so it can kind of diffuse out slowly, then this fat inside, this bone marrow can get, kind of exit into your bloodstream in these big fat globules and, travel to your pulmonary circulatory system near your lungs, and it can cause blockage. Now, your lungs can filter out a lot of this, meaning everyone gets a fat embolism. However, if it exceeds the amount of lungs can filtrate out, then you're going to develop what's known as a fat embolism syndrome, where it could cause shortness of breath, rashes, confusion, and other things. But worst case scenario, you die. That's right. It's a very, very deadly complication if it goes wrong, okay? Now, this is usually going to happen within a day or two after surgery. And like I said, this is why techniques like venting were developed to prevent the overload that the lungs, this ability that lungs have to filter out that fat. But they do have treatments available like ECMO, ventilation, blood thinners, corticosteroids, and, just allowing for the body to just heal itself. But they can be avoided by close monitoring of, the pulse ox during surgery when they're reaming to make sure that your blood oxygen level doesn't drop below a certain amount. And it's also why it's really risky to implant 4 intramedullary nails, 2 into your femurs and 2 into your tibias on the same day, because it really elevates the chance of this occurring. And this is a deadly complication. You do not want this to happen. If it does, hopefully you're at like a really good clinic that can take care of you. But this is pretty much what the fat embolism is. All right, so the next avoidable complication is a pulmonary embolism. And it's very much like a fat embolism, but it's a different type of blockage. It's from a blood clot that can actually break off and travel through your vascular system, through your veins, all the way back to the lungs. And it can cause blockage there. And if it does, it can be life-threatening if it blocks your pulmonary vein, preventing proper oxygenation of your other tissues. And this can usually occur because of immobilization after surgery, poor blood flow, and that's why it's so important to start getting movement on top of taking your anticoagulants and blood thinners during your lengthening process. Okay, it has a lot of the same symptoms that fat embolism has, including death if you don't catch it in time. So lots of motion, no smoking, and just keep notifying your surgeon if anything feels off. Okay. All right, so next up we have axial deviation, which refers to the misalignment of your bones where they don't form a straight line after surgery, which can lead to potential deformities, joint stress, and even possible loss in length and height. I know, scary. But when I say straight line, it actually is a little ambiguous because the femurs aren't, orchestrated in a straight line. They're actually at an angle. Their anatomical axis deviates from their mechanical axis. But if it's outside of the acceptable range that's when it would be considered axial deviation. All right. Now, the tibia is relatively a vertical bone, but the surgeon, how does this happen? Improper surgical technique with the lengthening device. So if you're lengthening and lengthening and lengthening and lengthening, and they're just not watching, you can develop what's called, knock knees or valgus, okay, or bow legs, which is varus. And what does this do? This can put a lot of stress on the joint and give you early arthritis. What are the treatment options? Corrective surgery. You're going to have to get another surgery just to get that fixed. And so if they don't do proper planning early on, look at the anatomical structure of your bones when you come in, then you can end up with a lot of this. And I've seen these complications more often than not. All right, so next up is osteomyelitis, which is essentially a bone infection. All right, so bacteria can get into your bloodstream and it can set up camp, in your bone during or after surgery. And this usually happens when the patient has an external fixator for lengthening and doesn't keep the pin sites clean, but it can also happen, intraoperatively if, there's not good surgical practice being used. But it's a very serious issue, and it often requires a course of antibiotics or multiple courses of antibiotics along with nail swapping, okay? So, there's actually research that proves that, antibiotic cement-coated intramedullary nails can help, treat this. But if it's serious enough and it's not, caught in time, it can develop into osteonecrosis or bone death. And bone death is when the bony segments are going to have to be removed and, possible bone grafting just to heal the bone back to its original form. Okay, so keep those pin sites clean. Keep your incisions clean, even if you have an internal nail, and monitor along the way. Make sure that you are going in for consistent checkups. And if anything seems like it's red, swollen, inflamed, or anything like that, you definitely need to get it checked out immediately. All right, now we're going to talk about a severe muscle contracture. And what this is a super tight muscle that can affect proper range of motion and function after lengthening. Okay, so during lengthening, muscles are going to get tight, okay? And they might get excessively tight to the point that it limits your proper movement, particularly around your knee if you're doing femur lengthening, or your ankle if you're doing tibial lengthening, okay? Now, the reasons why this happens is usually because patients lengthen too fast, they over-lengthen what their body can tolerate, or there's insufficient physical therapy or stretching. It's not something that happens overnight, so it's usually due to negligence, on somebody's part, either the surgeon, the physical therapist, or the patient themselves, okay? So how do you treat this? Well, aggressive physical therapy, and if that doesn't work, you're going to need a soft tissue release to get back the proper range of motion in the joint, okay? So how do you prevent this? Basically, consistent physical therapy, stretching, and lengthen according to what your body can tolerate, okay? And use what I always say to lengthen and observe. While you're lengthening, take note. Hey, is my knee bending and is it not going back to its full extended position after I stretch it? If it's staying in this really hard contractile state, then maybe I should get it looked at or slow down my lengthening or stop my lengthening until I can get it back into an acceptable, angle, a joint angle. Okay, because if you don't, you're not going to be able to walk properly. Okay, tight muscles are going to affect your walk. You're going to be essentially crippling yourself. So I see this a lot, at clinics where there's a lot of patient pleasing going on, meaning they're just trying to hit a number or a certain height, and they don't care about what's happening to their actual leg functionality. And that's abusing this limb lengthening procedure. That's not what this is about. This is about safely getting you to your goal in one piece without sacrificing, any of your functionality. You never sacrifice function for length. All right, now we're going to talk about nerve damage. So what is it? Well, it's nerve damage, as simple as that. It's when the nerve sustains damage where it can no longer function optimally, okay? Or it may not function at all. Essentially, it's from lengthening too fast or lengthening too much or from severe compression or overstretching the nerve, and it just doesn't have its proper function anymore, okay? There is treatment out there, such as decompression. For example, in tibial lengthening, there's the common peroneal nerve that, branches off of the sciatic nerve, and it wraps around near this fibular head, okay, on the lateral side of your lower leg. And this is a tightly confined space, so the surgeon will go in prophylactically, meaning, intraoperatively during surgery, and they're actually going to release the area around there so they can kind of let the nerve breathe and have, better breathing room so that when you're lengthening, it doesn't get tugged on and snag around that area and lose functionality to lead to something called drop foot, which is the inability of you to lift or dorsiflex your foot up like as if it was normal, okay? So you will actually have problems walking, and this can be permanent,
Okay, you can lose full functionality of this nerve if you don't catch it in time. So that's really important that you mention to your surgeon, you notify them of any limp, numbness, or weakness in the limb that was there before, okay, or you can get something like drop foot. All right, so now we're going to talk about compartment syndrome. And essentially, this is increased pressure within a compartment. What is a compartment? Well, it's basically divisions of soft tissues, grouping of soft tissues divided by fascia, right? So if we look here at this cross-sectional area of your lower leg, we can see the posterior compartment, which is where your calves would be. We can see the lateral compartment where the peroneus would be. We can see the anterior compartment, which is really important because a lot of patients who do tibial lengthening will undergo compartment syndrome from here. And what is that exactly? It's basically when you lengthen too fast or lengthen too far. If there's extra swelling or inflammation in this lower leg, it can cause a lot of strangulation of the vessels in this small compartment, which are blood vessels, which could lead to reduced oxygen delivery and something called hypoxia, which is lack of oxygen, and pretty much cause tissue damage and even tissue death, or nerve damage like this deep peroneal nerve here, which is like your common peroneal that branches off, and this helps out with your dorsiflexion. So if you get strangulation of this nerve, you could also get drop foot, okay? So what the surgeon will do is basically treatment, which is a fasciotomy, where they take a small slit of the fascia and they slit it down, and it allows breathing room of this anterior compartment. So think of like when you wear a really tight jacket and you can barely breathe, but then you unzip it and now you can breathe again. That's basically what a fasciotomy does of this anterior compartment, and allows you to let these vessels have breathing room during lengthening. Okay, how do you avoid this in the first place? Well, basically doing it prophylactically or during the time of surgery, and also lengthening and observing. It allows you to basically see how things develop, and if the patient notices extreme pain in the front part of their shin or extreme weakness in their foot's ability to raise up, then that means that they should probably go seek medical treatment immediately and get that anterior compartment released. But again, the surgeon will do what they need to do in this area, but it's something that you should know about that is really important for tibial lengthening. All right, next up is a non-union, and that is basically when the bone ends fail to heal together. They're no longer talking. So this could take a really, really long time for the bone to heal, or it might just not heal at all. And how does it happen? If you're lengthening too fast for the bone ends to actually unite or union together, or if you're a smoker, a heavy smoker, that can affect your health and your body's ability to heal, or if you have poor nutrition or you're not resting enough, all of these are factors that could lead to you developing a non-union. The treatment methods are usually a bone graft, and they usually need stability, blood supply, a stimulus, and sufficient nutrition to make that work as well. Sometimes they'll use a bone stimulator, which is using different technology like LIPUS, which is low intensity pulsed ultrasound, or PEMF, which is pulsed electromagnetic fields. And then they usually fixate it with some sort of device implant to kind of like make sure that the bone ends start to talk to each other again and heal. Okay, so how do you prevent this? Basically, you just want to make sure you're lengthening and observing. Okay, so you want to make sure that you're going in for those biweekly checkups or sending in your x-ray so you can see how the bone healing is going. A lot of times it'll be a delayed union before it becomes a non-union, but the surgeon should be able to catch that in time and take early action. Premature consolidation. So this is when the bone ends actually heal too soon during the lengthening process, preventing you from reaching your desired length, okay? As you can see in this, x-ray, you can tell that this side is actually only at 45 millimeters. This side's at 49 millimeters, meaning that this side's probably still lengthening. This side has reached premature consolidation, where the bone is no longer lengthening because it's healing too soon, okay? How does this happen? Usually it's age, younger patients, or if you're lengthening too slowly, or sometimes taking too many supplements, the body can synthesize bone really easily from that, okay? So what's the treatment for this? So the surgeon's going to perform another osteotomy and re-break the bone, as simple as that. Unfortunately, it is another surgery, but it's quick and easy, but you just want to try to avoid this as much as possible. So how do you do that? Lengthen and observe. If they are seeing these at biweekly checkups, they're going to catch it. Unless, the patient's super young and they're just healing faster than they can even catch it. That's rare. But by taking early action, they can usually avoid this altogether. All right, so now we're going to go over the avoidable complications comparison chart, and we have two columns. We have the complication, and we're going to talk about its degree of severity. I didn't want to put the likelihood that each might happen because they're avoidable. They shouldn't happen. But anyway, let's go ahead and go over these. So the first is the fat embolism, and this gets a 10 out of 10. Look, it's a very serious complication. It moves fast and it's heavy. But if it's monitored correctly, you can definitely avoid it, but it can cause death. So that definitely gets a 10 out of 10. Next up is pulmonary embolism. It gets a 9 out of 10. It's almost just as serious as a fat embolism. The only thing is that it happens over the course of lengthening, and if you have enough blood flow, usually clotting, and you're on your blood thinners, usually clotting is kept to a bare minimum. So this usually isn't a huge issue, especially for patients with weight-bearing nails. They're moving all the time. But if you're taking blood thinners and you're doing, your physio, you're moving around regularly enough, you should be okay. But just avoid immobilization, all right? Because that can lead to a very serious pulmonary embolism, which could also be deadly. All right, next up is axial deviation, which we talked about, misalignment of bones. It gets a 7 out of 10. Osteomyelitis, basically bone infection, gets a 9 out of 10. If you're losing your bone because of an infection, that's not good. It's not deadly. It can lead to amputation, and it can also be deadly if the bacteria spreads, to other tissues. But it's pretty serious. Then you have severe muscle contracture, gets a 7 out of 10. It's usually not going to be the end of your life, but it can be the end of your functionality and your walk. You can look crippled for the rest of your life if it's severe enough. Next up, we have nerve damage, which gets an 8 out of 10. If you get something like drop foot and it's permanent, you're not going to be walking properly, okay? So you really need to realize that that's a serious complication. And if you get nerve irritation early on, you want to let the surgeon know. It's a good symptom to pay attention to. Then we have compartment syndrome. Same type of thing. It can lead to nerve damage and drop foot. It gets an 8 out of 10 as well because it can lead to permanent paralysis of your dorsiflexion ability. So the next up we have a non-union, which gets a 7 out of 10. It's not the end of the world, but essentially you're just living off of the fixation device, because without that your bones would pretty much fall apart and collapse. So it's not great at all. And then finally, premature consolidation is when the bone ends heal too soon. Not a huge issue. That's why I gave it a 5 out of 10, the lowest one on this chart, because just a simple re-break can put you back on track.
Now onto the recoverable complications. So they're still not fun, but they are more common, yet they're manageable when it comes to getting over them with an experienced surgeon by your side. They include delayed unions, mild muscle contractures, nerve irritation, pin site infections, hardware malfunctions, and IT band rigidity or regrowth. Now, as we chart these guys out, I'm going to give you a rough estimate of how likely each one is to occur.
All right, guys, so now we're going to go ahead and break into the recoverable complications. And these are ones that, are more common, and when they do happen, it doesn't mean the end of the world, okay? There's not a whole lot of surgical intervention. There's a lot of conservative methods that are taken to kind of help you get back on track. All right, next up we have delayed union, and this is basically when the bone ends heal slower than normal. And there's a lot of reasons why this can happen, but usually it's from lengthening too fast, insufficient nutrition, or even just the patient's genetics and their healing rate. It really does depend. It's not always clear cut of why delayed unions happen. They're not quite non-unions, but because it is still healing, they are still talking to each other, each of the bone ends, but it's just not happening at the average rate. Okay, so what are the treatment methods? Well, there's quite a few actually. So usually they're going to start with the most conservative, which are things like bone stimulators, which are using those technologies like lipus or PEMF. Sometimes they'll try things like BMAC injections, which is bone marrow aspirate concentrate. They're going to use stem cell injections, PRP, Forteo, which can help with fracture healing. Nutrition, upping your nutrition, make sure your calories are sufficient. Supplements, vitamin D3, calcium, vitamin C, and collagen, which are good synthesis, a duo of synthesizing bone together. Mechanical stress, just walking, and then just time, right? Because sometimes it just takes extra long for the bone to heal. But how do you prevent it? Lengthen and observe and take an early action. Okay, it can happen to anybody, but it's hard to say for sure for a delayed union. But you just want to kind of focus on doing everything you can as a patient to check all your boxes and make sure your bone heals on time. All right, so now we're talking about mild muscle tightness, and this is basically when the muscles become tight or taut during lengthening. And how does this happen? It's usually due to lengthening too fast or not enough stretching, but it can sometimes just happen, right? So if you're going for any substantial amount of length, a lot of times the muscles are just going to kind of, go past their reserve slack, if you will, and they're going to get tight. So How do you treat it? Just more PT, slowing down your lengthening, or even stopping for a few days. A lot of patients just stop for a few days. The bone won't consolidate a lot of times, and you can alleviate the stress on the muscle and then continue lengthening, and observe over time. Okay. Nerve irritation. This is pretty common actually, especially in femur patients, but it's usually when you get discomfort, tingling, or even some pain in the nerves from the lengthening process, and it usually happens because the patient's lengthening too fast or too far. But even then, it can still happen. Sometimes the nerves are just really, really sensitive and they get irritated by the slightest bit of, lengthening, and that sometimes happens. And how do you treat it? Usually slowing down is the best way to kind of calm a nerve that has been irritated. Sometimes taking an anticonvulsant like gabapentin can help, and that can kind of help the irritation as well. But again, lengthening and observing does work really, really well. Just going slow enough, paying attention. If you get some irritation, slow down. You'll want to just listen to your body, and realize that this is pretty common. It's one thing that you just have to pay the price for sometimes. And some patients get it, some patients don't. But it's not abnormal to get some sort of nerve irritation when you're lengthening a lot of tissue. All right, we have device malfunction, and this basically refers to the bending or breaking of the nails, screws, and or fixator frames during the lengthening process. And it usually happens from, too much load bearing or weight bearing on the device, or if it's a faulty device, or even if you fall or, misstep. A lot of times accidents happen and they can break these devices. They're not invincible. Okay. So what are the treatment methods? Well, it's usually just replacement of the device, such as a nail swap or other frame fixator. They're going to fixate back in place. But usually prevention is key. Just use caution. Okay. Slow down your life and your emotion by, half at least. Okay. I like to say that you want to go quarter of the speed that you were previously going before you had the surgery done, and everything will be okay. If you start to try to move too fast, there's a lot of force put on the implant, and things can happen. So if you get a break, you definitely want to you'll probably feel it first, but definitely let the surgeon know ASAP, and then get that taken care of. So next we're going to talk about pin site infections, and this is basically where the pin sites from external fixators can become infected. Okay, so these pins that are on the external frames go through your skin, through your fat, through your muscles, all the way into your bone, and basically bacteria can seep its way in here, get all the way into your bone, and do what we talked about earlier, create osteomyelitis, which is bone infection. But if you do your job and see any type of discharge show up, you want to keep it clean, keep these pin sites clean. And sometimes this can happen even for the internal nail incision sites. It's very rare because once your skin closes up, it's a pretty good barrier against bacteria. However, if anything does happen, if you do get an infection from a pin site or incision site, usually the treatment is going to be antibiotics and just kind of keeping it clean with changing your bandages and stuff like that. But all right, so the final recoverable complication that we're going to talk about is IT band tightness. And this is essentially when the IT band can get really tight and contracted from being tugged on by the TFL during lengthening. Okay, so the TFL is this muscle up here in your upper proximal portion of your hip, and the IT band kind of merges into the IT band, which goes all the way down and attaches to your lower leg. Okay, and if the surgeon does not release the IT band and you're lengthening your femurs, then you can get a severe abduction of the legs, which in the limb lengthening community is known as wide legs. And if no release is done, or if an improper release that isn't, good surgical technique is done, or if the patient's lengthening too fast for the muscle to kind of compensate for that, then you can get this abduction, and it can really look weird, but it can also affect other soft tissues and alignment things. So it's really important that, the treatment is you undergo the treatment, which is basically getting a prophylactic release of the distal portion of the IT band and possibly the proximal portion if you're really muscular and don't have great flexibility up there. Okay, the best way to pretty much prevent this is to lengthen slow enough so that you can catch it and handle it. Sometimes really good physical therapy can help out, but usually a prophylactic release is going to be the best treatment for this, and just not over lengthening. So sometimes even if you get a prophylactic release and you over lengthen, you will still get that tautness, and you don't want to have that. Okay, or if you do get it and you didn't get it lengthened, released, you can go in and get it released after. But who wants to just do that? Just get everything done in one surgery. if possible. All right, so that is the last recoverable complication that we're going to talk about. All right, so now we're going to talk about the recoverable complications comparison chart. Same thing, we have two different columns, the complication and the likelihood that it actually might happen, because these are more common than the other ones that we talked about, especially the avoidable ones, which shouldn't happen too much. So for the delayed union, that gives us 7 out of 10. Look, it happens more often than not. I've gotten a lot of emails. Patients say, hey, my bone's taking a long time to heal, or sometimes they don't get their nails out until 1.5, 2 years because the bone wasn't ready. That means that they faced a delayed union, okay? Or if they see the surgeon, they just want them to kind of wean off of the walking assistance well past when most patients would be walking by. Well, that's a delayed union. The bone just taking longer to heal, okay? The next up is mild muscle tightness. I should probably have put this a little higher than a 5 out of 10, but I think I did that because some patients say that they have pretty darn good flexibility towards the end of lengthening, whereas others have to kind of really, fight their way to get even just normal, acceptable amounts of range of motion. So, yeah, that gets a 5 out of 10. Nerve irritation, not as common, but patients do get some sort of nerve irritation, and we're talking about things like the sciatic nerve, or, sometimes the saphenous nerve, or sometimes the deep peroneal nerve. So it really does depend on what you are going to feel, but nerve irritation could also be umbrella, or could contain things like numbness, okay? Then we have hardware malfunction. This isn't very common. It does happen. I have seen that patients who get their nails removed, broken screws, broken crowns, broken nails. It does happen, but it doesn't happen as much as you think. Even fixators have issues as well. We have skin site infections. Now, for skin site infections, pin site infections, for the X-Fix, pure X-Fix, or a lengthening over nail, it's really high. Almost guaranteed you're going to get some sort of skin pin site infection and have to run a course of antibiotics and really keep them clean. But if it's for an intramedullary nail, it's very, very low, okay? Sometimes the incision sites do get infected or red and inflamed, and you can just usually wait it out, sometimes run a course of antibiotics, but it's not very common at all, and it's unlikely that it will happen. And then finally, IT band tightness. This is about 50% of the time, because I think patients are really, really trying to, push the amount that they can get on the femurs, and a lot of them just go for 8 centimeters if the nail can get to that, or even more if they're getting it with a different device. And a lot of times that can lead to IT band tightness, where they get those wide legs and abducted, walk like that. But look, it's still recoverable. You get an IT band release, or you just kind of wait for it to resolve through aggressive physical therapy. So,
all right, so real quick, I want to give you guys an analogy of surgeon experience. So think of an experienced surgeon like a skilled batter in baseball, an accurate slugger, if you will, okay? They're more likely to nail the ball and hit a home run with less at-bats, meaning they're going to do it successfully, performing your surgery and monitoring you along the way with few to no complications. Whereas less experienced surgeons, on the other hand, might struggle, leading to more complications more frequently, like striking out in baseball without ever getting the player or the patient to even load the bases in the first place, and have to wait to another inning, which could mean another additional surgery. So then it comes to patient responsibility, and as much responsibility as we would like to put on the surgeon for a successful outcome, I have to say that the patient plays an equal or possibly even greater role in mitigating the complications, okay? One of the most crucial decisions you're gonna make for limb lengthening is choosing the right surgeon. You wanna opt for an experienced, reputable professional who prioritizes your health and well-being over what I call being a patient pleaser, okay? Meaning giving you unrealistic expectations, hitting a ridiculous lengthening goal in a short time frame, and doing, quadrilateral lengthening with internal nails on the same day, and just bizarre stuff. All right, a good surgeon won't just do the surgery well, but they're also gonna guide you away from over lengthening, which can lead to several of the severe avoidable complications that we mentioned earlier. And just as important is your commitment to consistent physical therapy. It's the key to smooth recovery. Physical therapy helps in preventing muscle contractures, maintaining joint mobility, ensuring proper muscle balance as you heal. And I'm not just talking about, showing up and going through the motions. No, I'm talking about actively engaging with your rehab and doing what's required to, keep up with the stretches and not fall behind, because it's very easy to do so. Also doing rehab exercises that will give you the biggest bang for your buck, even when you're tired, because that's when it counts the most. And this is especially true for patients who are aiming for any substantial amount of length, extreme amounts of length for any given limb segment that their body can tolerate. And lastly, as a compliant patient, you need to be aware about your symptoms that you might experience and changes in your condition along the way. okay? If your leg sends signals to you, don't ignore them and say, hey, I have to get to 8 centimeters, bro. I just have to get 3 inches taller no matter what. No, that's there's a difference between being, tough and being stupid. If something feels off, let your medical team know ASAP, okay? Early intervention can be the difference between a minor recoverable complication and an avoidable one that we talked about earlier that could become, possibly permanent. So yeah, don't be a passive patient in your lengthening journey. You're an active architect in your successful recovery. All right, guys, that's all I have for you today. Look, if you are a current or former limb lengthening patient and you faced any of these complications that we talked about today, feel free to share your experience in the comments below and how you were able to manage them. Did you get them corrected, or are you still suffering in silence? Now's your time to speak up. So I hope you guys found the video helpful. If you did, go ahead and hit that like button. Be sure to subscribe. And until next time, this is Victor from Cyborg for Life, signing out. Peace.